dot. Here we go. Okay? So, again, right? This is a negative feedback loop. Okay? We use negative feedback loops in the body all the time. We get too hot, we get too cold, our blood sugar goes too high, our blood sugar goes too low. Right? Our breathing is too slow, our breathing is too fast. So, negative feedback mechanisms, loop, whatever you want to say, they're happening all the time, right? It's just like a thermostat for what we need, back and forth, back and forth, back and forth, to keep us between the lines, okay? Right? So we use them a ton. And there's a sentence I should write on the board. Let's see. Can't remember. I want to make sure I get it right. Okay. This is important that you get this, okay? All negative feedback mechanisms have the same goal, right? And that is preventing sudden, severe changes in the body, right? Yes? Again, I liken the negative to the thermostat, yes? Right? So the whole purpose of negative feedback mechanism is to keep us between the lines, to keep us at homeostasis, to keep us from perishing, basically, right? And they're very common, and they're going all the time, just all the time, right? Too hot, too cold, too hot, too cold. Yes, right? That's what it is when you climb mountains. You're either hot, 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 cold, cold, cold. You finally, warm up, and then you make the top of the ridge, and there's a 60-mile-an-hour wind blowing over it, and you're freezing again, right? You're never comfortable. But anyway, negative feedback mechanisms. Make sure you get that. And this is your example, too hot or too cold, of a negative feedback mechanism, okay? And again, we'll talk about this when blood sugar and respiration and all that good stuff. That's negative. Now, we're going to talk about positive feedback mechanisms, okay? I'm going to go ahead and erase this. And again, this is just from your book. This is just a graphic or a figure in your book, right? Now, okay, make sure you get this. All negative feedback mechanisms have the same goal, to prevent sudden changes in the body, right? In the body, yes? Okay. Positive feedback mechanisms, okay, usually control infrequent events that do not require frequent adjustment. Okay, let me write this one too, and then I'll explain that, okay? Okay, let me explain that. Real simple, right? Okay. Okay, a positive feedback mechanism. You don't really have to write this down, but I just need you to understand this, okay? It's very simple. Positive feedback mechanism are usually infrequent events that do not require frequent adjustments, right? Your temperature, right? We're constantly having to make adjustments for that. Respiration, whether we're running or walking or sitting, we're constantly making adjustments for that, yes? Okay, the example the book gives and is, for a positive, is you cut yourself, right? Now, if you cut your finger, you start bleeding, yes? Right? And we'll study about the platelets, the blood cells, right? Thrombocytes, okay? So what happens is this. Platelets are very sticky. Platelets are activated by calcium, and platelets plug the hole. If you get a hole in a blood vessel, the platelets plug the hole, right? The platelets, okay, here's your blood vessel, here's your hole, and the platelets start sticking around the edges, okay, of the hole. And they build up more and more and more and more, right? Yes? And they continue to build up more and more and more and more until you're not bleeding anymore. Platelets plug the hole, right? I'll say that about 1,000 times before these 2 semesters are over, right? And so what happened was that the stimulus is we cut ourselves. The reaction is those platelets start building up, building up, building up, right? But our body temperature goes up and down, up and down, up and down. It's a negative feedback mechanism. But this, the platelets build up more and more and more until the platelets plug the hole and you stop bleeding. Yes? Right? That's what happens. That is an example of a positive feedback mechanism. You don't cut yourself very often, right? But you got to regulate your temperature, your heart rate, your breathing 24/7 all day long, yes? Right? But you don't cut yourself that often, yes? And the stimulus proceeds in one direction more and more and more and more and more and more until the situation is corrected, okay? More platelets are going to build up more and more and more and more until it's over, right? Yes? Now, the young lady in the back corner here, did you tell me you have children?
Yes, sir.
Okay, would you mind if I ask you a couple of questions?
Sure.
Okay, yes. All of a sudden, ka-ching, wow, that first time, you realized, my water broke, I'm having a baby, right?
Mm-hmm.
Yes? And then you start having contractions, right? And then the contractions kind of got more, yes? And then the contractions got more. And then the contractions got more, and you went to the hospital, right? Yes? And before that was over, what happened? You ended up with a baby, right? Yes? Right? So they came on, they got stronger, 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 and eventually you delivered a baby. Yes?
Sure.
Right? And then it was over. Okay, all right. I was hoping it's going to work with you because I know it doesn't with some, but anyway. Right? Yes? Do you decide, you know what? I don't think I want to have this baby today. I guess I'll have it tomorrow. No. It comes on, and it gets worse and worse and worse. Right? Yes? Till you end up with a baby, and then it's over. Yes? Right? Those contractions generally are going to get more and more and more and more and more. And the stimulus goes higher, 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 higher until you have the baby, then you stop having contractions. Right? Yes? Yes, ma'am.
What about when they...
Okay. When they induce labor, right? Yes, because the doctor needs to play golf. Right? It's got a tea time, so come on, hurry up. Yes. Okay, same thing, right? They induce labor, right? They'll give you the medication. I'll think of the name of it in just a minute. Oxytocin, right? They give you the Pitocin, And if you don't have the baby, they'll give you more. And if you don't have the baby, they'll give you more, right? Because they got a golf game to get to, right? But those contractions go more and more and more and more. And the Pitocin is actually a medicine based on oxytocin, the hormone we're going to talk about in the neuro chapter, right? And it's the cuddle hormone, the hug hormone, and the squeeze the uterus hormone. That's what it does, right? So it's the same thing. It's going to get higher, 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 right? Until you have that baby, yes? So in the same way, it's a positive feedback mechanism, and then it gets stronger, 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 stronger until you have that baby, right? Yes? Okay. So that is the difference. A positive feedback mechanisms, we don't use those very often, and they get more and more and more and more, and they go in the same direction, higher and higher, until the situation's over and taken care of. Negative feedback, we use that all the time. We use these little micro adjustments, right? So maybe I'm sitting and I need to breathe 12 times a minute, but then I get up and walk down the hall and I need to go up to 15 times a minute because I'm walking slowly, right? So these little bitty minor adjustments are going to be through a negative feedback mechanism. And things that don't happen very often are going to be through positive. And again, the positive, the stimulus gets more and more and more and more. Or the reaction gets more and more and more and more until the situation is over. Okay? Does that make sense? That's the difference. Frequent, infrequent. Stimulus goes up or down. To keep you between the lines, this one, no, it only goes one direction. You're eventually going to have that baby, or the bleeding's eventually going to stop, right? Yes? So that's the difference between positive and negative feedback mechanisms. Okay? Yeah. Okay. Now, let's talk about some terms, right? This is table 1.1 in your book. Write that down, table 1.1, right? And again, you got to learn the language. This relates to basically we're doing more lab stuff now, okay? Right? Yes? Okay, I'm going to go through the words and explain them to you, right? Superior or cranial, right? This is your cranium. Superior, right? Inferior or caudal. That's the tail end of your spine here, caudal, right? So superior or cranial or inferior caudal, right? Yes? Ventral and dorsal, right? Okay. Anybody like sharks? Sharks have a what fin? Dorsal fin, right? So this is ventral. This is your ventral side. This is your dorsal side, right? Okay? Ventral, dorsal. Okay? Now, the anatomic position, right? You've seen Leonardo's picture, right? The Vitruvian man with the cool hair, right? Yes, okay. That's the anatomical position. Note, palms forward. Yes? That's the anatomical position, right? When we describe things from the anatomical position. Yes? Okay? So, ventral and dorsal. Medial. Medial means toward the middle or midline. Yes? Okay? And the opposite of that is lateral. Yes? Right? When you play football, the quarterback sometimes takes the ball, steps back, and laterals it to someone, right? He hands it to him back here, right? Doesn't always throw it, yes? Lateral to the sides. Lateral means to the side, okay? That's where that comes from, okay? Intermediate, between a more medial and a more lateral structure. We don't use that very much, but anyway. Okay, proximal versus distal, okay? You got to know proximal versus distal, right? Okay? In relationship to the midline, okay? Proximal versus distal. Proximal means closer to the midline. Distal means like distance, further away from the midline, okay? Right? Okay. Right? Here's my hand, and here's some fingers. Right? Here's my wrist. Right? And these are the tips of my fingers, okay? Right? This joint here, okay, let's put it this way. This way is distal. This way is proximal, right? When I go away from the midline, that is distal. Okay? Closer toward the midline is proximal. Okay? This joint right here, my knuckles, that's a metacarpophalangeal joint, right? And this next joint is the PIP, proximal interphalangeal joint. It's proximal. I have the exact same type of joint right there, but that is distal. It's further away from the midline. So that is the distal interphalangeal joint, and this is the proximal, right? My wrist is distal to my elbow. My elbow is distal to my shoulder joint, right? Because distal means further away. If I'm comparing this and this is distal. This is closer to the midline. It is proximal, right? Yes? Now, if you fracture your tibia, right? Or your femur, right? Yes? Yes? Right? They're going to write an x-ray report, and if it's fractured down here, they're going to say it's a complete fracture of the distal, right? This is your hip, your pelvis, right? Of the distal femur, right? Yes? This is distal. If it's broken up here, right? How many of you know old people break their hip? Right? Yes? Yes? Most of the time it's going to break actually across here. But anyway, this is proximal, that is distal. Right? So when they describe the surgery that they did, blah, 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 did you have to have surgery, sir? Yes? Okay. I'm pointing at this gentleman because he's one of those manly men that played football. And, yes, I heard 3 girls jumped on top of you one time and broke your hip. That's what I heard. I don't know. It's word on the street. But anyway, right? But anyway, so he had a fractured femur is why I did that. Okay? Distal, proximal. Distal, like distance far away. Proximal, closer to the middle. This is the midline. Yes? Okay? So, got to get those words. Proximal versus distal. Okay? Superficial on the top. Ooh, I can't stand him. He's so superficial. Oh no, this guy, he's really deep. Yes? Right? Deep versus superficial. Yes? Right? Okay? I think you folks probably know what that means. Okay. Next thing we got to talk about, again, more lab stuff. Yes? Okay. One thing I want to mention too is, when we say left or right in the medical profession, right? We're not talking about your left or right. We're talking about the patient's left or right. Why is that a big deal?
It's the opposite.
Because why?
Opposite. this includes.
Okay, my friend Troy, many years ago, his wife had a lump in her breast. And he told the doctor, I want to talk to you before you go cutting on my wife. So they're ready to do the surgery, and the guy comes out with the scrubs and this and that. And he said, tell me what you're going to do. And he said, well, she's got a knot. I'm going to take it out. We're going to see what it is. Right? Yes, little lumpectomy right there on her left breast. And he said, whoa, 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 whoa. It's not on her left breast. It's on her right breast. Right? True story. Oh, by the way, it's way bad when they cut the wrong foot off. Yes? It's way bad. I had a lady that was a nurse aide in Amarillo for like 15 years. She said, oh yes, Dr. Weld, it's very bad when that happens. Trust me, I know. Right? So when we say left or right, we're talking about the patient's left or right. We're not talking about our left or right. We're talking about the patient's left or right. Okay? Right? Yes? Nowadays, to try to prevent that, they mark them with a skin pencil, which one they're supposed to do the surgery on. Right? And they're supposed to check it 3 times. Okay? Right? It's like the bank teller, she counts your money, she walks over in front of you and she counts it out again right in front of you, doesn't she? Right? Yes? Okay. So, anatomical position and such. Okay? Now, let's talk about the planes of the body. The planes of the body. Okay? Now, we have advanced imaging. We have advanced imaging nowadays where we can do CT scans and MRIs and PET scans now. Okay? And so we need to get planes of the body. All right? Now, again, this is figure 1.8. Write that down. Figure 1.8. It's planes of the body. Yes? Yes? Okay. So let's talk about the different planes of the body. Planes meaning, okay, let's start with the easiest one. The easiest one. Mid-sagittal, S-A-G-I-T-T-A-L, right? Or if it's over here, we will say sagittal, right? Okay? A sagittal plane means you divide the body into the left half and the right half, okay? Right? Again, this is the patient, this is the left, this is the right. If we split them right down the middle, right? It's mid-sagittal. Mid-sagittal, okay? Right? But if we split it over here, think about this. If I order an MRI, I want to see if somebody's got a blown disc. That disc is going to be right down the middle, should be, right, for the spine. So I'm going to order mid-sagittal. Yes? Conversely, if I'm doing this gentleman's AC joint, am I going to do mid-sagittal? No, I'll miss the joint. No. Is it your left? Okay, I'm going to do a left sagittal section. Right? Yes? So I can see his shoulder. I'm not going to do mid-sagittal. But sagittal splits the body to left or right. It's not that complicated, right? Now, frontal or coronal? F-R-O-N-T-A-L. Frontal, also known as AKA coronal. C-O-R-O-N-A-L. That divides it into anterior, posterior, right? Right? So, if we cut the body this way, right? Front and back, anterior, posterior, right? That's a coronal section, okay? That's a coronal section, right? Or a frontal section, yes? Okay? And so usually, like with the MRI, it'll do slices. It'll do slices this way. Okay, transverse 2, we'll talk about that in a moment. But anyway, yes? Because if they're wanting to look at the pituitary to see if you got a pituitary tumor, they'll take slices through there, pictures through there, right? Okay? So, when you split the body from front to back, that is coronal, right? Or frontal. Yes? Okay? Now, we also have transverse, 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 right? Here's our little person. Yes? Right? And if we go and we cut through this way, guess what? That's transverse. Okay? If I'm looking for a tumor in the liver, right, then I'm going to do this. Slice, 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 slice on all those pictures. Okay? When I was in high school, I went to Baylor College of Medicine, okay, on a field trip. And I got to go in their A&P lab and see the cadavers, right? And this was pre-MRI, pre-CT scan days, right? And there was this real long hallway. And this real long hallway had this big counter. And here's the wall here, and the counter was like this. And it looked like there were portholes right here that were glass, that were flat. Yes. And guess what they did? They took a cadaver and they cut half-inch sections, put it under the glass, and then they cut another half-inch section. They put it under the glass. That whole hall was one person, all the way through. It was pre-MRI. Now we do it with the MRI and we don't have to kill someone, right? But back then that was pre that, right? Because I'm old. But anyway, yes, transverse sections right through this person, just right through this person. And each little porthole, right, you could look, wow, wow, deeper, 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 all the way through, right? Now, the MRI does that now, right? And the CT scan right now without having to kill someone. But anyway, that was pre that. That was in the olden days, right? Yes, before you were even a twinkle in your mama's eye, right? Yes? Okay, so really cool though. That was a very fun field trip. I like that. Yes. So, yeah. Okay, so you have to learn the three different planes of the body, right? Sagittal, left and right. Coronal or frontal here, anterior or posterior. Anterior towards the front, posterior towards the back, right? And transverse, transverse sections through the body, right? And that's why if you look at an MRI film, there will probably be several hundred little pictures about this square because it's sections. It can be sagittal sections or it can be transverse sections, right? So it's common, people have brought those to me and I looked at them. And the mid-sagittal section, you'll see the vertebrae, right? And you will see, right, the spinal cord. And you will see that herniated disc putting pressure on that spinal cord there and such, or protruding back into that spinal canal, right? Now, if I look at it from the top, I see the vertebrae, right? Here is that, and I will see it bulging here, or possibly over here where the nerve comes out, right? Yeah? So I can look at the transverse section, or I can look at mid-sagittal, right? Yes? To see what I'm looking for, right? Okay? Now, technically, I'm not qualified to read the MRIs, and guess what? Neither is your medical doctor. You got to be a radiologist. But they're so amazing nowadays, you can look at it and like, oh, yeah, okay, there's a problem right there. And it's usually, unless it's something that's pretty minor. Okay? So, okay, I got to talk faster. Okay. Okay, we did that. We did planes of the body. Okay, Now we need to do body cavities, right? Body cavities, and this is figure 1.9, okay? Lovely picture, figure 1.9, right? All it is we talked about this is ventral and this is dorsal, and we have a ventral and a dorsal body cavity, right? Okay, now, right? If you look at us from the side, right? The brain and the spinal cord, right? That's your dorsal body cavity. Are in the dorsal body cavity, okay? Very simple. The brain and the spinal cord, they're in the dorsal body cavity. The back. Yes, your spinal cord's back here. Yes? All the stuff in the front, your heart, your lungs, your kidneys, right? Yes? Yes? Anatomically correct, but anyway, yes? All the stuff in this, that's your ventral, right? It's very easy to remember as long as you remember ventral and dorsal. And the only thing in the dorsal is the brain and the spinal cord. Everything else is ventral. All your abdominal organs, all your pelvic organs, it's all in the ventral, right? What is in the posterior? What is in the dorsal, right? What is in the dorsal body cavity? Your brain and your spinal cord, two things, right? Yes? So that's the difference between those two. I may ask you, the heart is in the ventral or dorsal?
Ventral.
Right? The spinal cord is in the
Dorsal.
dorsal, right? Super simple, right? I remember two things. The brain spinal cord is dorsal. Everything else ventral. Everything else ventral, right? That's the two body cavities that we talk about, okay? Ventral versus dorsal, okay? Yes. Okay. And remember, right? The shark has the dorsal fin, right? That's how you remember dorsal. And I was trained 40 years ago, this old chiropractor. We say thoracic spine. The old chiropractor would never say thoracic spine. He would say your dorsal spine, your dorsal spine. That was something they were trained with so many years ago. Okay? Okay. 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 Take this out for me. Okay, this is the lab part, right? Take this out. Yes? Pardon me. We are gonna have a quiz on these terms right here. Yes? And we're gonna go over them. We'll go over them multiple times, so we're gonna start by going over them. Yes? Okay? Okay. Abdominal, right? This is your abdomen, that's abdominal, right? Pretty simple. Yes? Okay, acromial, right? The shoulder blade comes across, and that bump right there, okay, this right here is the acromion. That is acromial. See, this is the spine of the scapula, and that bone right there is the acromion, right? Acromioclavicular AC joint, that's where that comes from, okay? That's the acromion, okay? Acromial, right here, the big bone. Yes? Does that not make sense? Yeah? All it is the end of that bone that sticks up, that makes up our shoulder, okay? The acromion, acromial, okay? Okay. Antebrachial. Brachium means your arm. Antebrachium, right? Antebrachium, the front of the arm, right in here, right? Antebrachium. Yes? Now, We're going to go over this multiple times. This is also a diagram in your book. We'll show these. Okay? Antebrachial, right? Now, how many of you ever had blood drawn, right? Yes? Okay, this hole right here where they stick the needle, that is antecubital fossa. That is the front, antecubital fossa. Okay? Antecubital fossa, right? Antecubital is the word. Okay? Antecubital. Yes? Okay? Axilla. Axilla is your armpit. That's your axilla. Axilla. Axillary. Right? Under your arm. Axillary. Axilla. Yes? Okay? Okay. Brachial. Brachial just means your arm. It's not specific. Brachial just means your arm. Okay? Okay. Buccal. B-U-C-C-A-L. Buccal. Right? What doctor talks about those? Not your medical doctor. Which one? Right? Right? The dentists talk about buccal folds. The dentist, buccal, usually. Buccal. Chiropractors don't usually say buccal. But anyway, the dentists say that a lot, right? Yes? Now, your heel bone is your calcaneus, calcaneal, or calcaneus. I'll take either, right? Calcaneal. That's your heel. Okay? Okay? Now, don't worry. We're going to go over these multiple times, right? You don't have to snap. Okay? You'll have plenty of time. Calcaneal. Yes? Okay. Crural. Crural just means leg, right? Crural means leg, right? Digital. These are your digits, right? Oh, by the way, guess what? Your toes are your digits too, okay? Digital, okay? Okay. Right? Femoral. This is your femur, the big bone in your leg. That's the femur, right? Femoral. Okay? You got a big artery, right? Aorta comes down, splits, right? Yes, someone shoots you, boom, you get a hole in your femoral artery, blood starts spurting, it's way bad. Right? The Deer Slayer. Yes, you've seen that movie, I'm sure. But no, it's a way old one. But anyway, right? Yes? Femoral, your femur. Femoral, your thigh. Okay? Okay, frontal. This is your frontal bone. There's several names for it, but anyway, frontal, right there. Frontal. Okay, right? Yes. Okay, gluteal. Yes, gluteal, right? This is your gluteus minimus, medius, maximus. Gluteal, right? Gluteal. Yes. Okay. Now, inguinal, right here and here. Yes, right here and here, right on the sides. Why is that a big deal? Right? Because about 1 in 4 men get an inguinal hernias. I got 2, right here and here, right? Usually men that lift weights. I lift my 600-pound motorcycle. But anyway, right? You get splits right here in the abdomen because anatomy, we'll talk about it later. But especially men who do heavy lifting, bricklayers, construction workers, right? Your husband or something? Oh, yeah. Okay. Right? I got them too. Chiropractors get them because I get a 300-pound guy on the table and I jump on him, right? So it's very common. Yes? Yeah? 5 more years, right? People ask me, Dr. Weld, how old are you? And I said, well, I'm too young for Medicare, and I'm too old for the girls to care, see? But anyway, 5 more years I'd be on the Medicare. I might get stitched up, but I don't know, right? So, yeah. And then when you get stitched up, if you lift heavy again, guess what? It can happen again. So, inguinal, that's a big deal. Inguinal. Ladies can get them here too, but not real commonly. Okay, inguinal. Right here and here on the sides of where the legs come down, right there and there. Yes. Okay, lumbar. This is your lumbar spine. These last 5 right here, that's your lumbar spine. Right? An old term for back pain, lumbago. Lumbar, okay? Got it? Okay. Okay, lumbar. Mammary, right? Ladies, use your mammary glands. Mammary, okay? Mental. Mental is your jaw, right? I don't know exactly where that came from or why they came that up. I know there's a hole in the jaw and a blood vessel, and a blood vessel and a nerve comes through it. The dentist got to be real careful not to poke his needle in it, right? That's mental, right? I don't know where that came from, mental, but anyway, they're talking about your jaw there, okay? Nasal, right? Nasal, yes, this is your nasal bone, right? Yes. Do you want to hear a joke from 1978? My instructor, Mr. Rourke, he said, this is one of the most important bones in the body. I'm like, really? He's like, yes. They even have a college to study that bone and named after that bone. I'm like, yeah, right. He said, no, it's the U.S. Nasal Academy. But anyway, right? It's from 1978, so it's an old joke. But anyway, right? Yes? You guys know Terry Turner? Cowherd valedictorian about 25 years ago. Oh, by the way, he's commander now in the Navy with the Naval Academy. And I was talking to I was talking to a young lady today. Her grandson, yeah, he just graduated in the Naval Academy. Yeah, cool. Okay, knuckle, Nuchal, right? It's a line across the back of your skull, right across here where ligaments attach, called knuckle or nuchal. Some people say nuchal, knuckle, right? Nuchal. Okay? Now, this bone right here at the back of our skull, okay? You know, this is a great skeleton. This is amazing, and this stand is the suckiest. Golly, this suck. Anyway, that bone right there at the very back of your skull, right? That's the occipital, or that the bone is called the occiput. Occiput. Occipital, right up there. Yes? Right? Occiput. Yes? You ever got a headache up under there? Oh, God, miserable,
Oh, yeah.
right? Yes? Yeah. Suboccipital. Right up under there. I have that all the time in my office. Suboccipital. Yes? Right? The occiput, that bone back there. Yes? Oral. Oral has to do with your mouth, right? Oral hygiene, right? Yes? Orbital. Orbital, right? Orbital. Yes? The hole where the eyeball sits. Orbital is related to that. Yes? Otic is your ear, right? Ear, otic, right? Yes? Palmar, palmar, yes. Okay, pelvic, your pelvis, right? Okay, the bottom of your foot, this is the plantar surface, right? That's the plantar surface, yes. How do you remember that? Yes, right? Nasty, dirty showers that haven't been cleaned in years, right? Yes, the guys who get the plantar warts on the bottom of your foot, right? Plantar. This is the dorsum, this is plantar, right? When you raise your foot up like this and the toe comes to your shin, that's dorsiflexion, right? And the other way is plantar flexion, just the opposite, okay? So plantar, right? Oh, by the way, what's the name for heel spurs? Plantar fasciitis, right? Plantar fasciitis, yes? Okay. Okay, popliteal. Popliteal right here, right behind that's a popliteal space, right? That's a popliteal space. Your knee does this, and when your knee is almost fixed and locked, there's a little bone called the popliteus. A little bone. There's a little muscle called the popliteus that does this and locks it in place. The knee, it's a very strong joint when it's locked because of popliteus, okay? That's the popliteal space. Oh, by the way, old people, they get a cyst right there, popliteal cyst, very common, sometimes called a Baker cyst, very common. I've felt thousands of them over the last 35 years, you know. What is this, Dr. Weld? Oh, don't worry, I know what that is. Don't worry, you don't have cancer, right? Yes. Pubic. Pubic is where the pubic bones come together, right? Put my foot on there. Right here, where the two pelvic bones come together at the front, that's pubic, right? This is your symphysis pubis, technically. But anyway, pubic relates to those two bones right there where it comes together in the front, right? Yes? You've all seen the movies of the guy riding the skateboard on the railing to the stairs, right? And then he falls off and, right, lands on his pubic bone. Yes? Okay. Scapula. Your shoulder blade is the scapula, right? Here, the shoulder blade, the scapula, notice it comes around here. Remember, this part of the scapula, the bony part on the end, is the acromion, right? But this is the scapula, right? Yes? Shaped like a shovel. But anyway, scapula, okay? Sternal, your chest, right? That's your sternum. Okay? Sural, S-U-R-A-L. Sural means your lower leg. There's a sural nerve. It's a lower leg, sural. Okay? Tarsal. Okay? Tarsal is your ankle bones. T-A-R-S-A-L. Right? Tarsal is your ankle bones. Right? And your foot bones are metatarsals. But anyway, right? Tarsal is the foot bones. Thoracic, that just means your chest. Thoracic area. Umbilicus, right? Umbilicus or umbilical, right? Your belly button, right? Your navel. And vertebral, right? That's just like this area over the spine here, right? Vertebral, okay? Now, right? That's a bunch of junk. That's a bunch of words. That's a bunch of stuff. Don't freak out. We're going to have time to learn those, okay? We're going to go over that multiple times, so don't freak out if you don't get it the first time, right? We're going to learn those over the next couple of days, and it'll be a week or so before we have a quiz on that, okay? And basically, I'm going to make a Xerox of the guy, and I'm going to put some numbers on there. You're going to tell me what it is, right? If I put it here, you're going to say umbilical. If I put it here, you're going to say gluteal. If I put it here, you're going to say oral, right? Otic, right? Frontal, right? Yes. The thigh, femoral, and your fingers and your toes are your digits, right? Digits, yes. Okay. All right. We're getting close, folks. We're getting close to the end, okay? So the last thing we're going to cover tonight is also kind of like lab, and let's talk about that. Okay. And that is the serosa, S-E-R-O-S-A, or membranes. Okay, parietal, P-A-R-I-E-T-A-L, versus visceral. Okay, right? Now, if you would, let me explain. The serosa is a membrane. There are two layers to it, and it secretes a fluid, right? It secretes a fluid, right? Yes? Okay, so, and so, the, okay, the heart here, right? We have a serosa around the heart. It's called the pericardium. Para meaning around, peri around, and cardium, yes? And it's shaped like this, and there's an outer and an inner layer, okay? Right? And that's going to be your pericardium, P-E-R-I-C-A-R-D-I-U-M, right? This, when you go to the gym and you're on the treadmill, you're doing what? Cardio, right? Pericardium, yes. Okay. So what happens is that there's some fluid in between these two layers, right? And I need to explain visceral. Viscer means organ, right? The membrane that touches the organ is the visceral pericardium, right? So that's going to be this one, the visceral pericardium. Now, the outer membrane that lines the cavity is called the parietal, P-A-R-I-E-T-A-L, parietal pericardium. Okay? Right? And so viscer means organ. It touches the heart in the pericardium. Yes? You got another one, you got lungs, right? You got two lungs, and that is called pleura, P-L-E-U-R-A. And you got the visceral, and you got the parietal pleura, right? And again, the outer one that lines the cavity is the parietal, and the inner one, I probably should be doing this in a different color, huh? But anyway, the inner one is going to be your visceral. Viscer meaning organ. It touches the organ, right? And there's one other, and that is a big one, yes. Right? Yes. And that is your peritoneum, right? Your abdomen. P-E-R-I-T-O-N-E-U-M, peritoneum. The visceral and the parietal peritoneum, okay? Parietal means it covers the body cavity. Visceral means it touches the organ, right? Okay? Okay? Now, again, all of these serosa, there's two layers, and they secrete some fluid. Okay, if you would put your pencils down for me for a minute. Put your hands together, right? And do this for me. Now, really push your hands together. Now do it faster. 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 My grandma's 93. She's faster than you. Come on, man. Right? What do you feel in your hands? Think about this. When you run that 5K and your guts are doing this, what are you building up? A lot of what? Heat. So that fluid, your heart's going boom, 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 right? So that fluid decreases the friction. You were feeling the heat from the friction, right? That is the purpose of the visceral, your heart beating, right? Any of you got any deer hunters in here? There you go, sir, right? What do you call this, by the way? Huh? When you feel clean the deer, what do you cut out? The
organs, the guts.
The gut sac. That's the gut sac right there. Yes, right? Yes, that's the deer hunters. They cut up the gut sac. Yes, right? Yes. And so, anyway, you have one set that covers your lungs, one set that covers the abdominal organs, and one around your heart. And we're going to talk about these individually in future chapters. But anyway, I need you to get that number one, they're called serosa. Okay, serosa. They secrete some fluid. It's mainly water with some protein in it, right? Yes. And there's two layers. And the visceral touches and covers the organ, and the parietal is more the hole, right? If you've ever cut a deer open and done that, there's a hole. All the guts are in a bag, right? Yes, that's a peritoneum. Yes, right? So, when you've had pneumonia, after that many times, you can get Pleurisy, Pleurisy, okay? In between these two layers of serosa, right? There's some fluid in there, and that fluid sometimes gets infected, and then you get pus, and then it sticks together, and you breathe. Every time you breathe, you get this sharp pain right there. That's pleurisy, right? Yes. Okay. Oh, by the way, what do you have hanging off your large intestine right there on the right-hand side, right down there? Say that again.
Is it the gallbladder?
No, no, ma'am. No, that's a little higher up. That's up here. Down low on the right. None of you teenagers have had that cut out yet?
Appendix?
There you go, appendix, right? Yes. Right. So that appendix gets clogged up, it swells up, and it can burst, right? And that can cause peritonitis, right? peritonitis, peritonitis, right? Yes, it's your peritoneal cavity, right? Yes, and way bad stuff happens to you if that happens, right? That's why they got to cut your appendix out before it bursts. After it bursts, you got major, major problems. You have to take major antibiotics. I had a patient, she lived to be almost 100. When she was 12 in the 1940s, her appendix burst. And a miracle of miracles, they did surgery and they saved her life, but she had trouble with her abdominal organs for the rest of her life. She ended up having 3 or 4 surgeries over almost 100 years. Yes? Lived down the street from me. My sons threw her paper for years. But anyway, yeah. What's another cause of peritonitis? The appendix can burst, but what else? Can you say lead poisoning? Right? Yes, 38 slug. Yeah. Took a picture of a patient one time. Oh, I forgot to tell you, there's a bullet in there. Right? Yes. Right. Line's right over here in the soft tissue of his neck. I'm like, boy, you were rowdy when you were young. He's like, yeah, I don't want to talk about it. But anyway, okay? Peritonitis, inflammation of the peritoneum, right? And again, the visceral and the parietal. Let me see if I have that page number written down. Okay. I'm going to tell you the figure that you can look at that shows these better than any. It shows these better than any, and it's way back here. I would tell you the page number, but in my book, the page numbers are different than the new ones. Okay. Figure 4.11 shows membranes of the body. Figure 4.11, you'll see these, right? Okay, the parietal and the visceral pleura, the parietal and the visceral pericardium, the parietal and the visceral peritoneum. Okay, right? Again, there's only 3: peritoneum, pericardium, pleura. There's only 3 of them, and then we divide those 3 into the visceral versus the parietal, pardon me, right? And visceral just means it touches the organ, right? Have you ever had a visceral reaction? Oh my God, that has a... Right? Yes, visceral. Yes, organ, it means organ, yes. Okay, so visceral, it touches the organ, parietal, yes. If you haven't figured out, I say some stupid, funny stuff, right? Because, have you ever had the teacher that goes up there and goes, blah, 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 right? Yes. So, if I say some stupid stuff, maybe you'll remember. Some of it's even funny too, but you're kind of young to get my jokes. But anyway, right? Yes? So, you got to know these. You got to know the visceral pericardium touching the heart and the parietal pericardium, right? Our book shows a picture of a balloon, and if you take your fist and you push it down into the balloon, where the balloon is big and round around your fist, and the part that's touching your hand is the visceral pericardium. And the outside of the balloon is the parietal, right? And the fluid's in the middle. Yes? That's the book's example, right? But anyway, you have to get that visceral versus parietal, and you have to get pericardium, your heart, cardio, heart, peritoneum, abdomen, and pleura, your lungs, right? Yes? So, it's not that hard. There's 3 times 2 is 6, right? Yes? You just have to know your words. You have to know the difference between visceral and parietal. I don't need to go over this again for you. Okay? Right? Because you're a smart girl, I can tell. But anyway, right? So make sure you get those 6 words. Yes? Okay? Make sure you get those 6 words. Yes? Now, let's talk about quadrants of the body. And I have to look. I think this is the last thing. Right? Quadrants of the body. Quadrans. Right? Yes? Okay. Joseph, you're good at math. Tell me this. How many wheels does a 4-wheeler have?
4.
4. Yes? Sometimes they call them a what bike? A quad bike. Right? Yes. Quad means 4. Yes. Quadrants of the body. Yes? Right? If someone's umbilicus is right here, yes? Right? Yes? And remember, anatomical position, right? This is the patient's left upper quadrant, and this is the patient's left lower quadrant, and this is the patient's right upper quadrant, and this is the patient's right lower quadrant, right? If you draw an imaginary line through the umbilicus this way and this way, right? And we divide the abdomen into 4 parts, right? Oh, by the way, right? Your liver, right? This is your appendix, right? Yes? Okay? So, I need you to get that. If I say, which quadrant is your appendix in, right? And I'm not going to spell out because I'm lazy. Right lower quadrant. I'm going to write R, L, Q, right? Right lower quadrant, left lower quadrant, left upper quadrant, right upper quadrant. R, U, Q, L, U, Q, L, L, Q, R, L, Q, right? Yes? So, it's going to be A, B, C, or D, and you're going to circle right lower quadrant. That's where your appendix is. Okay? And if I ask your liver, right? Yes, my mom made 90 years, right? She said, oh, we come from a family with long livers. We're long livers. Yes? The liver's in what quadrant? RUQ, right upper quadrant, right? Now, let me explain. Our book also does the same thing, only it does this. 1, 2, 3, 4, 5, 6, 7, 8, 9, right? And every spot's got a different name. But Dr. Weld is so nice, he's just going to say, what quadrant is it in, right? I'm not going to make you learn epigastric and all that stuff, okay? I just want to know the quadrant. If I ask you where the appendix is at, you're going to tell me what quadrant it's in the body, right? Okay, very simple. Got it? Yes? Now, there's a picture of that. There's a picture of that. Figure 1.11. Okay? 1.11. Okay, let's see. All right. Okay. Everybody got one of these? Yes? Hey, now, here's the thing. Okay? Yeah, don't be overwhelmed. It's not that hard. Yes? I know you're like the first day and there's a gazillion things, right? Yeah. Okay? Don't be overwhelmed. This is first day, and most of the days are not like this where there's so much stuff. Okay? Tomorrow night we're going to talk about pH. We're going to talk about basically chemistry, simple chemistry that you learned when you were in, hopefully, physical science, 9th grade, Mr. Canales, right? Yes? Okay? And such. And so I do need to warn you, tomorrow night's going to be kind of long. We're getting out pretty early. Usually I try to get out by 8:30 and such. And remember, Thursday night, we'll get out real early, okay? I'm going to Utah on my new bike, all right? Any questions before we go? Let me turn this off.
Is this class Monday